काय हे काय इथून येस hello everybody. I am Dr. Mukund Sabnis, working on obesity and metabolic disorders since last 30 years. One by one we are going into the deep dive of some of the substances which are used in medicine as well as in kitchen, and it makes a lot of confusion among the people that that substance which we are using in the kitchen, how can it be working in medicine? So we have seen about jaggery, we have seen about sugar, we have seen about salt and its impact on blood pressure, and glucose, its impact on blood pressure. So when we see about sugar, and when we have seen about sugar and fruits, means sucrose, sorry, it's glucose and fructose. Now the third sweetener, which is very controversial but widely used all over the world, is honey. And today we are going to deep dive into honey for its activities, for its biochemistry, and for its Ayurvedic property, because Ayurveda has promoted honey in majority of the disorders. And the most controversial disorder, what I feel, is diabetes and obesity. Honey has been promoted since antiquity in obesity, and many societies, many communities in India as well as in the world, they use honey for the treatment of obesity. Now the big questions arises here is that when we are restricting sugar, when we are restricting disaccharides, when we are restricting glucose, when we are restricting fructose, when honey is again a mixture of glucose and fructose, then how it can be recommended in obesity and diabetes and any other anabolic disorder? There are controversies that, okay, it has lot of sugar, then whether honey will increase sugar in diabetic patients, that is a big question. And that's why many people are into ambiguity that whether I am diabetic, whether I should use honey with the medication, whether I should take honey with the water, or whether I should take honey with some other dietary recipes what we promote, or can honey be added to some other recipe as an ingredient, and whether that is okay to have with the obese people or diabetic people or the people of anabolic disorders. So that makes honey a very controversial issue, because Ayurveda has strongly promoted it. And this strong promotions, very correct quotations are there. And on top of that, Ayurveda promotes what we can call as honey as a regular food condiment. This is very striking actually. When on one side, when we say that honey is full of sugar, and on one side it has been promoted as a regular food condiment since thousands of years, and that too no controversies in anabolic disorders like obesity and diabetes, how this, whether this promotion of Ayurveda towards honey is correct or not. So when they talk about consumption of honey in the 5th chapter of the Charak Sutra Sthan Matra Shiti Adhyay, they clearly say that Shashtika Chali Mugdanscha Sendhava Amalake Yavan Antarikshapayam Sarpi Jangalam Madhucha Abhyasayet. So whatever the Abhyasya Sanyani Dravyani they have mentioned, whatever the substances which is to be consumed in a regular fashion, and in that honey or madhu is one of the ingredient. So there are no, they have not mentioned any contraindications for honey. So whether this can be consumed by obese people, so there are many then controversial comments. Okay, we prescribe honey medicines with honey, we prescribe honey with water, we prescribe honey along with food, and there are many people who restrict prescribing honey. So what should be done and what is the correct way to prescribe it is very important. What are the technicalities behind that? So when we want to understand the technicalities of honey, we have to see that honey is a mixture of glucose and fructose. Along with that, It is not the like glucose and fructose. Glucose and fructose are the complete molecules, a single molecule, a single chemical. Honey is a matrix. That should be understood very correctly. That honey is not only glucose and fructose, but along with glucose and fructose, it has several enzymes, it has several pollens, it has several flavones, flavonoids, and certain anti-nutritional chemicals coming into it. This is not with glucose or fructose, what we or a disaccharide like sugar when what we buy from the market. But it is very important again, because when body metabolizes honey, it looks glucose, it looks honey, and it's actually it breaks down the honey into again glucose, fructose. So chemically for the body, it is ultimately as the end result, it is a glucose and fructose. But along with that, the flavones, flavonoids, the pollens, and the enzymes which are present in honey play a very, very important role. And that's the reason that honey has been said that it is a Yogavahi. Now, the concept of Yogavahi is completely an Ayurvedic concept. It is a merit of Ayurveda that there are certain substances. Bhavaprakash has clearly mentioned, Sushruta has clearly mentioned that honey is Yogavahi. And they say that Bhavaprakash says that Grahanati Yogavahi Dravyam Sansargi Vastu Gudan Pacchamanam yathait tan madhu jala taila ajya suta lohadi. As madhu, it is like oils, it is like ghee, it is like mercury. It carries the property of the associated substances with it. It enhances the property of the substance with which it is associated. Hence, honey can be called as a biomarker. This is not a property of sugar or fructose, means glucose or disaccharides or fructose. It is a completely different property. But ultimately, we should remember that it is again a glucose and fructose. So it enhances the drug delivery because of the Yogavahi property. It acts as a bioenhancer. I don't know whether the bioenhancer is the right word for it, because there is no appropriate word in English for Yogavahi. There are different terms which are coined, but still now we haven't found any perfect term for Yogavahi. But it improves the tissue penetration, it improves the uptake. How it improves the uptake? Because of its bacterial load, because of its flavones and flavonoids in it, and because of the particular matrix of honey. It is known to enhance, it is known to correct the gut flora. Now, when we say that honey is lekhana, what is the definition of lekhana? Dhatun malanva dehasya vishoshya lekhayachet. So emaceration, or it is a limited nourishment of the tissues when it goes in excess. That is a lekhana. And honey has been said as lekhana also. So when we say that honey is lekhan, then it means that it may have some activity on either on the adipose tissues, because we have to see that adipose tissues are different, cholesterol are different, and triglycerols are different. But it has a particular activity, neither on cholesterol, but it has a particular activity to lower triglyceride levels, which has not yet been seen in the humans in the clinical trials. But it is known in some of the cases, it is known to reduce triglyceride levels by correcting the complete gut flora. Certain human double-blind clinical trials are also available, but they don't show the direct impact on triglycerides, but it has a good impact on the gut flora. So when consumed for pretty long period, because what is the issue, honey, they have clearly proposed, Ayurveda scientists, they have clearly proposed the taste of honey is madhu and kashai. So the astringent taste recepting activity is antagonized for the sweet taste receptor activity, and that's why it can be a lekhan, it can have a lekhan activity into it. So that is the one of the important reason that honey can have been used in obesity and diabetic like severe anabolic disorders. But apart from that, there are certain other technical reasons, other biochemical reasons of use of honey in all this obese and diabetic patients. So when it comes to honey using in obesity, one quotation has come in the 21st chapter of Charak Sutra Sthan, 26th shlok. They say that bhojanartha prayojani panam cha madhu udakam. Bhojanartha prayojani panam cha anu madhu udakam. Means when you have a meal, after that meal, you should have madhu udaka. What is madhu udaka? It is again a mixture of honey along with water. Why they have proposed that after the meals, they have proposed that you should have honey with water, and many people follow it. Not only that, when it comes to early morning, people go to a walk and they have a honey and water. Whether this is good or bad, nobody knows. Nobody can clarify whether it is good or bad. But some food research, some biochemical research, they suggest that drinking honey along with water can help the person to correct its microbial flora and have some good impact on the metabolism. Now, when it comes to this bhojanartha prayojani panam chanu madhudakam, so after the food you have to take madhudakam. So they say that Chakrapani says that nacha madhuno vrishya prayogeshu drishtatvat brahणत्वं वाच्यम yato yogavahi madhu yada vrushyena yujyate tada vrushyatvam. Means if you are giving honey along with the aphrodisiac medicines, which are sexual stimulant, it will work as a sexual stimulant. That is the importance of its yoga vahitva. It's very important. But when it is coming lekhana yuktam to lekhana karam, means if it is added with some medicines which has a emacerating effect or scrapping effect, or what we can call as enhancing the catabolic activity of the tissues like fats, then because of its yoga vahi property, it works as a scrapping agent, or it works as a non-nourishing agent to that particular tissue. So lekhanayuktam tu lekhanakaram yatha swarupenapi vrukshadigunayogat karshanam. So because of its roughness in the property, due to the kashaya taste, due to the astringent taste, it has been used as a very important medicine while treating obesity and diabetes. So it is correct. But when it is correct, when it is to be consumed, and how much it is to be consumed is a very, very important part when we are consuming honey. So nana dravyatmaktvacha yogavahi param madhu. So whatever what Sushruta tells, that you add honey with different types of drugs, it will behave differently and differently and differently because of its yoga vahi property. So this yoga vahitva or bio enhancing activity of honey is a very, very important part. So it is, as per Charak Samhita, it is known to reduce, it has to be used in obesity, in diabetes and all these things, and useful also in dyslipidemia and scraps excess fats. How it scraps? That's very important. When we say it scraps, on one side we say it has a glucose, it has a fructose. On other side, we say that it has to be used in anabolic disorders also. So considering the nourishing taste, that is madhura, and absorbing taste, that is kashaya, it is having a dual activity. It is having a unique dual activity, and due to this dual activity, it can be used widely with many of the medicinal plants and many medicinal formulations. Now, if you compare honey versus sugar, what is good? Honey is a bioactive substance. It is a bioactive. Sugar is not a bioactive substance. It is empty calories. It is useless calories coming from sugar. On the contrary, if you see the glycemic index of honey, the glycemic index of honey is literally little bit lower than the glycemic index of sugar. Combinedly with fructose and glucose, the glycemic index, as compared to this, the glycemic index of honey is little bit lower than compared with completely glucose. And honey has a balanced sugar and its metabolism is much much better than sugar or fructose also. Now when we talk about metabolism of honey and it's better than sugar and fructose, what is the difference? And the difference is that it has been seen in some of the animal experiments and very very few of the human experiments, that the spikes we get through honey, the spikes we get through honey is different than the spikes of insulin we get from either sugar or fructose or glucose. When we consume glucose or when we consume sugar, the insulin spikes are very big and they are sharp. On the contrary, when we go with the honey, the insulin spikes are delayed and they are blunt. The insulin spike doesn't go very high. And if the insulin spike doesn't go very high with honey, then the impact of the glucose and fructose into that substance on the insulin, because insulin is a driver hormone for all anabolic disorders. Until and unless insulin spikes are controlled, you can't control anabolic disorders. And with honey, the insulin spikes are literally controlled, and literally they are blunt as compared to disaccharides or sugar. So this is one of the important property of honey. Apart from that, honey is what we can call it, it absorbs moisture. It has a tendency to absorb moisture due to its glucose content, and because of the absorption of moisture, it can be used very nicely as a local antibiotic because it dehydrates the microbes. It can be used in local. So in the World War First, for the soldiers, honey was used mixing with olive oil. Olive oil and honey, they were mixed together for the dressings, and these dressings shows very good healing effect as compared to other antibiotics local application. And today also, honey can be used very nicely for the dressing purposes, and thus honey can prevent the growth of the microbes also. This is very very important. So the growth of the microbes can be controlled with honey very nicely. Then the mucosal drying effect of honey is very good, that it reduces the kapha dosha, and it is useful in cough and rhinitis because of the it reduces kapha dosha, and it impacts on the mucosa by drying the mucosa because of the hygroscopic nation, property of the honey. So this is again a very very different and unique property of honey. So because of its low pH, because of the high osmolarity of the honey, because of the hydrogen peroxide present in the honey, and hydrogen peroxide getting into the reaction and getting active in the metabolism of honey, it is having a very good antimicrobial activity also. Thus, in the particular doses, this can be used along with medication, what we call as anupan. So along with some formulations or along with medication, honey can be used due to this property of osmolarity, this property of pH, this property of hydrogen peroxide getting part into the metabolism of honey. Now the most important part, a very important part where it is very very closely related with Ayurvedic concepts and which is not at all followed. The part is that when we say that honey is a complete matrix, not only molecules, so this complete matrix also contains certain enzymes. And this, one of the most important enzyme is glucose oxidase enzyme, and this glucose oxidase enzymes produces H2O2 when it is getting metabolized, and this is responsible not only for healing, but this is responsible for many metabolic activity which are working on either fats or triglycerides. So the important role is of glucose oxidase enzyme. Now what happens, Ayurveda has clearly indicated, I'm repeating it, it is a very, very clearly indicated that honey should not be heated. Honey should not be consumed with even lukewarm water. There should be no direct connect of heat to honey. And this is a big missing link. It's very important. This is a very big missing link, that honey should not be heated. And whatever honey we are getting into the market, this is all processed, boiled, and heated honey we get in the market. And then whatever the property we are describing about honey, whatever the good properties we are describing about honey, those properties, they get diluted when we are heating honey. What they have said, madhudakam. Madhudakam means, again, when we are adding water to honey to water in a very small portion, the activity of glucose oxidase enzyme is increased, and that is the best part. So honey can be consumed by putting it in the water in a very small portion. Maybe 2 ml to 5 ml of honey in a glass of 200 ml of water can be added, which will enhance the glucose oxidase enzyme activity. But the whatever the important part is there, the idea is that it should not be heated. And whatever the honey we are getting into the market, it's completely processed honey, and you will not get property of the honeys when it is processed. So the notion behind all these things, the underlying line is that whatever honey you are consuming, it should be consumed in a raw form. Raw honey is to be consumed, and nowadays it is very difficult to get a raw honey into the market. If you want to produce honey and if you are bringing it to the market, so there are certain regulations that honey should be first heated and then bottled. And this heated honey will not deliver any of its pharmacological activity. It will not deliver its correct metabolic activity. And whatever the consumption we are consuming with the heated honey, we are just consuming it as a sweetener, but not as a medicine. This is very important. So when we are diluting honey in water, in the plain not lukewarm water, but room temperature water, we are adding honey, so it activates the enzyme, that is glucose oxidase, and this activated enzyme will give a very good property of the antimicrobial action. Not only the property of antimicrobial action, it will also impart what we can call as allergic reactions, or it can be a very small immunostimulant in rhinitis and bronchial asthma. Because of the small amount of pollens present into it, these pollens can be used as sensitizers, and we are heating it. This can damage the flavonoids, flavones, and the pollens which are coming from the different types of herbs and different type of plants into honey. So that's why heating is not important. Second important part, where the regulatory affairs has not been focused on, maybe it into the food or maybe it into the medicine, that when we are heating honey, it creates high amount of advanced glycation end products. So rather than taking it as a medicine, we are taking it as a poison. Because these advanced glycation end products, when we are heating honey in the absence of water, then what happens? There is a Maillard reaction, and due to this Maillard reaction, advanced glycation end products that like what we can call as carboxymethyl lysine will be created, that can again deposit into the, because those are the unwanted substances to the body, and such type of processed honey if we are consuming, those can deposit into the smooth muscles, those can deposit into the liver, making the liver fatty, making the smooth muscles and arteries and muscles harder and harder. So see that whatever the good qualities of honey which are mentioned, maybe in the old text or maybe in the newer text, the condition is that it should not be heated. And if we are heating it, then it is never recommended. So this is the heating effect of honey, which destroys enzymes, which reduces activity, and that is not completely recommended, because it again increases the advanced glycation end products in the honey. So this is a very important part. So the raw honey is very best. Unprocessed from the beast we should collect and we should consume as it is, and it maintains the enzyme. So how much honey is to be consumed? Why honey has a medicinal activity? Because it has a flavonoids. These flavonoids, they have antioxidants. These flavonoids, they are having anti-inflammatory property. These flavonoids, they reduce the oxidative stress, means reducing oxidative stress, reducing anti-inflammatory activity, reducing inflammatory activity, and reducing antioxidants or free radicals is one of the worst part of the honey which is heated. So these flavonoids should come to help. And then how much dose? Then when it comes to the dose of honey, again we have to remember that body recognizes honey not as a biological substance, but when it uh, what we call as disintegrates honey into the body, the other molecule, that is glucose and fructose, are also generated. So those people who are under metabolic syndrome, those who are obese, those who are diabetic, they should be very very cautious when we are consuming honey. So this cautiousness should be there regarding the dose and the frequency. So what is the frequency of honey? At what frequency you are consuming, whether you are consuming it in the food, whether you are processing it, on that it depends how much honey should be used. So on an average, honey should be used up to 2 ml to 4 to 5 ml depending on your own condition of the body. And what are the conditions? How much insulin sensitive I am, how much fatty liver I have, what are my blood sugar levels, and what are my lipid levels, and apart from that, what are my uric acid levels. So if you are considering all these things, then only, if you know all these things very correctly, so first we have to identify whether I am fit to consume honey, and all my parameters are normal, then I am fit to consume honey. But remember well, though Ayurveda has promoted to consume honey, that honey consumption and those properties of honey which are promoted by Ayurveda are only for the raw honey. The glucose oxidase activity, when what we expect from the honey, is only in the raw honey and not in the processed honey. So see that whatever honey you are consuming, that is a raw honey only. Second important part, when we are using honey in our food as a food condiment, see that don't apply it on the bread, because it already have, bread is completely, this white bread is completely refined carbohydrates. You are again adding glucose and fructose on it. Here the antioxidant, if you are considering honey is very good antioxidant, and apply it on the bread, it will lose its antioxidant activity, because the refined carbohydrates will mask these activities. So use honey in food condiments very, very cautiously. Never and never heat honey. Sushrit, Charak, Bhav Prakash, and many of the Ayurvedic texts, they have clearly promoted thousands of years back that honey should not be heated. So see whether you are fit to have honey or not, and enjoy the goodness of honey. Thank you. Thank you very much.